The heart, along with the digestive system and the respiratory system, are directly controlled by the brainstem, which is the first thing created in the human body during development. All electrical signals that pass through the nervous system, including the ones that control heart rate and blood pressure, they pass through the brainstem. Unfortunately, the brainstem sits in a very delicate area structurally. It's in an area where the spine, where the head and the neck meet right at the top. A misalignment in the upper neck is to the brainstem like a quarterback who injures his throwing shoulder in a football game. Even if the injury doesn't keep them from playing, it still disrupts rhythm and timing, especially the longer the injury lingers. Many people suffer a head and neck misalignment during youth, so it has many years to linger before eventually rhythm and timing gets thrown off. When that happens, blood pressure is often affected. Also, it's possible that heart palpitations may result from that rhythm and timing being thrown off. The first bone in the neck, the top bone, C1, it's the most susceptible to getting stuck in a rotated position that disrupts the blood flow through the arteries that run up either side of it. Blood flow decreases to the brain when that happens. So what do you think the heart would have to do? It would have to work harder as a byproduct. Blood pressure and heart rate would naturally increase from that, especially the longer it takes place over time. It begins as a hiccup, kind of like spending $50 more on a credit card than you pay off every year. But, all right, hang on, just let it keep going. It begins as a hiccup, like spending $50 more on a credit card than you pay off every year. But interest and further spending adds up over time, and then eventually it becomes more noticeable. If you correct the head and neck misalignment, then it allows the brainstem to resume its normal rhythm. It also allows normal blood flow to resume. Blood pressure decreases accordingly. There's some fascinating studies on this. One hit the mainstream in 2007, so I'd recommend doing a search for upper cervical and blood pressure. You'll find some good stuff.